Okay, welcome again to this episode. So today I will be talking about coronavirus, the COVID-19 vaccine, and the level of things right now. Countries like Rwanda has promised its people or the citizens that they are going to get a free vaccine by next year. So since some countries are beginning to adopt the vaccine, which is one of the videos I did earlier, which is UK has agreed to the vaccine. A lot of countries have not yet accepted it, like the US is still negotiating and still checking and looking for ways to make it happen. But Britain has already, accepted it, and also they've started trying to see how they can start trying it on their people. And so African countries now are the next in line, like the one the former Minister of Finance, Ngozi Okonjo-Iweala, Dr. Ngozi Okonjo-Iweala, said recently that they are in negotiation with the the companies that are producing this vaccine, which is about two companies, BioNtech and AstraZeneca, that they are negotiating for African countries through a particular platform that will help them reach the poor countries, so that they will not have to be in line, they will not have to queue with richer countries like the US and bigger countries that have more finance to run these things compared to African countries. Of course, the rate of the coronavirus or the COVID-19 cases in Africa has been somehow low. Like Nigeria, it's not that high compared to countries like US, Italy, India, China, and all those countries. So, but that doesn't mean that it is not still posing a very big risk, because according to Dr. Ngozi Okonjo-Iweala, if as long as one person has it, it's still a risk to every other person, because anything that is still being carried around by one person as a disease can easily be moved, or can get someone else infected, and eventually it can spread again. So as long as one person has it, no one is safe. So as long as the vaccine is working, then everyone should have access to it. So the fight right now is to make it available to African countries, that are still around the middle and low end countries with little finances to cater for such medical requirements. Of course, we know that of US is short. They can afford it. They cannot afford it. They can easily raise money. But Africa is something that is peculiar to the way we do our things in terms of things that has to do like that. But Rwanda has promised that his people will start getting it by March, and it's going to start from those that are actually the frontline workers, which has to do with medical doctors and nurses, caregivers, and all of that. All those people that are actually the frontliners that are much more exposed to the disease, and then also the elderly and those that have underlying illnesses. And the same thing for Nigeria. But Nigerians we are not yet sure if it's going to be a free vaccine, if they are going to make it free. But of course, we hope that the same thing is going to apply, because if it has to do with money, it has to be do with money, and is expensive. It will be difficult for a lot of people to get that vaccine. Even though the fact that they know that they can be infected, I mean, not everyone can afford that. We don't know what the price is, but we already know what the economy is. And it's according to the economy that we'll be able to start postulating what it will be like when you start bringing something like that, especially when some people still don't believe in the disease. Some people still don't believe that it is real. Some still think, okay, the government or whoever people that are promoting this are trying to use it to scare people, that is all about moving money and all of that. So some people still don't believe. But of course, a lot of people already believe because they have seen the cases. And even though the cases are still low, just of recent, Nigeria had the highest level that it has had, since the virus began, which is still not even up to 1,000 cases in a day. But okay, look at a country like Rwanda having about 6,000 cases, so it's still minimal. While a country like US have had over 200,000 deaths already, with over millions and millions of infections and millions of cases. Even China, Italy, and other countries. So Brazil and all of that have had it very, very, very worse compared to Africa and compared to Nigeria per se. So, but we hope that this vaccine thing gets sorted out, and by next year, January, we'll start seeing more about that coming down to the African countries. And we hope that it comes very fast, so that we can quickly get rid of this COVID-19 and restore back normal life and normal activity, and everyone can go about their businesses. Thank you for listening, and see you in the next one.